Proctor. Thousands of Montanans gathered in Helena today, where they walked in support of mental illness education and research. It was all part of the 12th annual NAMI Walk. MTN's Zach Briggs has more.
One in 5 Montana families struggles with someone who is experiencing mental illness. The Treasure State also bearing one of the highest suicide rates in the country, but thousands convened in Helena to help spread awareness and bring down those statistics.
One of the things that NAMI is always working on is trying to beat the stigma against mental illness.
Matt Kuntz believes there are misconceptions surrounding mental illness, impressions that in some cases deters those affected from seeking medical aid. That's where NAMI comes in.
We try to get as many people as possible in Memorial Park and teach them that these illnesses are not something to be afraid of. It's just another medical condition like diabetes or anything else.
You never want to lose a child.
Gary Popiel from Bozeman lost his 2 daughters to suicide. Ever since their passing, he's remained a strong advocate for educating the community on the topic of mental illness. Last year, Montana State University established the Center for Mental Health Research and Recovery, a $1.4 million grant recently awarded which will explore various mental illness intervention strategies. Gary expressing optimism as the research initiative gets underway.
And that's going to have huge benefits for Montana, and I know it will save lives and save families.
One of the projects will look into a youth suicide prevention method that's proven most effective in 10 European countries. MSU's Matt Byerly explains.
This intervention called Youth Aware Mental Health, or YAM, actually was the only intervention that was superior to the control group. It reduced suicide attempts by almost 60%.
The study is expected to be completed by 2017. Until then, Montanans will march on, recognizing that mental illness is a widespread issue, the battle ongoing. Reporting in Helena, Zach Briggs, MTN News.
Thank you, Zach. Now on to Bozeman. People waved purple, blue, and yellow flowers today at Bogert Park. The Alzheimer's Association put together the Walk to End Alzheimer's, collecting almost $45,000 from donations. Close to 300 people showed up to join the walk or participate in the event. Those who held orange flowers meant they supported the Alzheimer community. The purple flower represented lost loved ones, and the blue flowers meant the participant was living with Alzheimer's.
Not nearly enough being done yet in terms of prevention or treatments or a cure. So those are things that the Alzheimer's Association is working on, and those are things that the people, by coming together today, by donating money, by getting friends to give money, they're helping to move this cause forward.
Helena held its own Walk to End Alzheimer's event yesterday, and Great Falls held one last weekend. Moving on now for a look at some of your health news or some of your health headlines. It's that time of year to start thinking about getting a flu shot. And national health experts suggest aspirin can help prevent 2 major health problems. The U.S. Preventative Services Task Force is recommending a daily low-dose aspirin to help prevent both cardiovascular disease and cancer. The independent group of health experts says aspirin taken over a 10-year period may help high-risk patients between 50 and 69 avoid their first heart attack, stroke, and colorectal cancer, as long as they're not at high risk for bleeding problems. A new study suggests a Mediterranean diet rich in extra virgin olive oil can cut women's breast cancer risk by almost 70%. Spanish researchers tracked women between 60 and 80 years old. Those eating mostly plants, fish, and olive oil appear to significantly reduce the likelihood of breast cancer. And health officials say this year's flu vaccine will be more effective than last year's. A strain of the virus mutated last year, and the vaccine was not considered a good match. Fewer than half of Americans get immunized, even though the flu kills about 24,000 people every year in the United States. Well, what a wonderful weekend this was. Meteorologist Ryan Rose is in the Weather Center with a first look at what we can expect as we start our work week. Ryan?
Yes, we've had a lot of wind earlier today, and some of the winds have died down since. As you can see, we still have a few spots that are a little bit on the breezy side. Great Falls, not too bad, 13 miles an hour. Cut Bank at 17, and you poor folks in Cut Bank have been dealing with 30-mile-an-hour winds pretty much all day long today, unless, of course, you like the wind. But we have had strong winds, and there are some spots in East Glacier reported winds of 79 miles per hour. So we have had very strong winds come through, and our current temperatures have been pretty pleasant, 60s and 70s. And yes, we only have 3 more days left of summer, and summer is going to be ending off in a bang with temperatures cooler on Monday. How cool they will get, I will have those details coming up in Storm Tracker Weather.
Thanks, Ryan. We'll see you soon. Meanwhile, moving now to Columbus, 5 structures burned in a fire in Stillwater County yesterday, and crews spent today mopping up. The Arrowhead Ridge fire burned about 660 acres. Columbus Fire District Chief Rich Cowger says it started in the Yellowstone River Ranch subdivision and spread to the Countryman Creek subdivision. The fire destroyed 2 homes and 3 outbuildings. The fire was about 75% contained last night. About 100 to 150 people evacuated 50 homes in Countryman Creek as precaution and to make it easier for fire crews on the main road. Those who evacuated returned to their homes around 10 o'clock last night. The fire burned mainly grass and some timber.
Predominantly, it was just a grassy fuel type, which people think, well, it should be easy to extinguish. But when you got a wind behind it, it literally will outrun the firefighters. It'd be sheltered down in the drainages, and as soon as it come up out of the drainages and get the wind behind it, then it'd take off and spot ahead of us. So we couldn't quite get ahead of it. And then once it got into the other subdivision, then it got into heavy timber as well.
Columbus received mutual aid from fire departments from Big Timber, Carbon County, Absaroka, Park City, and Nye, along with the Department of Natural Resources and Conservation. Now to that story we told you about earlier. Black Eagle volunteer firefighters recently endured an inspection that would allow the department to receive a new license they've never had before. MTN's Margaret DeMarco found out how the inspection went and what it means for residents in the department's district.
These days, firefighters respond to more medical calls than fires.
We were trying to help the ambulance with lifting patients and getting to scenes.
But Black Eagle Volunteer Fire wanted to do more when it comes to medical calls. That's why they applied for a basic non-transport license. They were approved last Wednesday.
Now we're able to go and do basic life support interventions on scene of any type of medical in our district.
Black Eagle firefighter McCrae Taylor helped make sure their medical bags had up-to-date supplies and everything they would need.
We're starting to do medical training so that they know their skills, they're comfortable with those skills.
Now firefighters can do simple tasks such as taking blood pressure and perform more life-saving aspects like CPR and even use an AED.
We're also able to help with people that have been in car accidents. If they have spinal compromise or cervical spine compromise, we're able to go and help extricate these people correctly and put them on a backboard and get them ready to go for the ambulance when they get there.
The volunteer firefighters plan to meet twice a month to practice medical skills and train.
It's important because with the distance from the ambulance service, we have kind of a time period that is critical in life-saving interventions.
The Quick Respond Unit still responds to all medical calls, but with the license, that means more trained people are available to save lives. In Black Eagle, Margaret DeMarco, MTN News.
The inspector also told the firefighters they have some of the best response times in the state.